Hello. Today we'll discuss prevention of overuse injuries. What is an overuse injury? It is a repetitive strain to a muscle tendon unit or ligament that results in pain, inflammation, and loss of function. Overuse injury can be a habitual activity, such as a business person who travels and lifts their suitcases all the time. It can be an occupational cause, such as a professional ballet dancer who is practicing 8 to 10 hours a day in pointe shoes. It can also be a recreational cause, such as playing the piano. Fatigue of the mentioned tissues lead to a chronic strain, tissue adaptation, and physiological process of injury. Overuse injuries are commonly caused by repetitive motions causing a strain and inflexibility of muscles, leading to a muscle imbalance, or psychological conditions. The psychological conditions consist of anxiety, work satisfaction, and physical and mental health wellness. Research has shown a direct economic correlation for overuse injuries leading to decreased productivity. A difference in sex, male versus female, do contribute to overuse injuries, with the females leading the way. The female sex encompasses a difference in anatomy, hormones, and actual physical activity compared to males. There have been many medical studies questioning stretching to prevent injury, but not stretching can cause associated muscles to be stiff or overworked. With overuse injuries, it is important to think of the body as a whole and that all structures are interconnected. Each joint has an agonist and antagonistic muscle that are both involved in producing a movement. The body has a top and a bottom, a right side and a left side, a front and a back. All these planes work in conjunction with each other and depend on each other for movement and support. When one side fails or is weak, then we get the counterpart to pick up the slack and work even harder to produce a movement. Disruption of normal biomechanics lead to overuse injuries. Treatment of overuse injuries includes relative rest or avoidance of the repetitive motion, decreasing inflammation, modification of activity, physical therapy to build a balance of muscles, and occasional modalities or medical procedures. Even though rest is encouraged from the aggravating motion, no movement is discouraged, as it may lead to stiffening of joints. Decreasing inflammation includes icing the area involved, possible compression of the muscle with an ACE wrap or brace, and elevation of the swollen injured area. Physical therapy can teach a patient home exercises, use modalities such as ultrasound and stimulation, and direct in modification of exercise. Medical procedures include corticosteroid injections, acupuncture, and even surgery. Most important, if you think you have an overuse injury, please visit your primary care physician for evaluation and treatment. For more information and an evaluation, please go to sdsm.com.